Well, finding breast cancer at an early stage increases the chances of survival. We all know that, but yet more than a third of Dallas County women do not get an annual screening mammogram. I'm one of them. So joining us now to talk about early detection is Dr. Darshan Gandhi. He's the medical director of oncology for Methodist Charlton Medical Center. And so shame on me for not going yearly. And I want you to tell me why it's so important.
Absolutely. First of all, it's a pleasure being here, and thank you for having us here.
Yes.
And thank you, Susan G. Komen, for doing this, because we need to reach out to people like yourselves. It is extremely important that women get screening for breast cancer at an early age. To Drew's point, and first of all, thank you for presenting that on a personal basis. That really brings a lot of limelight to what really has to happen early on before it is too late while we catch breast cancers. Breast cancer has become one of the most curable cancers, and the reason is that we have so many powerful and effective screening techniques that we didn't have before. Not just that, we have more and more data coming out that if you are able to risk stratify people, that means you look at their history, their family history, their risk factors, you're actually able to pinpoint when you can actually start screening and what is the advantage you get if you start early screening. As we all know, there are two major types of screening procedures, mammograms and MRIs. Now we have more and more data, if you have a strong family history, that you pretty much need to use a combination of mammogram and MRI for early screening. Just to give you a general idea, there's a huge difference in survival between stage 1 and stage 4 cancers. Stage 1 cancers in general, there's almost a 95% survival at 5 years.
Wow.
That number drops to less than 50% if you're stage 4. So again, coming back to Drew's point, and he provided a good comparison between the two different situations, that itself should be a deal breaker. The earlier you get screened, higher the chances that you catch cancer at an early stage, and more can be done about it.
Now, doctor, we hear a lot about it in the media, though. Some new report comes out, they say, get an early mammogram. Another one comes out, says, no, you don't need one so early. So when should we start thinking about having our first mammogram?
And you asked a burning question. That brings into light, again, a lot of discordance in the medical community, and also discordance amongst the different organizations that come up with guidelines. For example, the American Cancer Society, and I'm with them, they recommend screening at 40.
Okay.
There are some other organizations like the USPSTF, which is the United States Preventive Task Force. They recommend starting at 50. Not just that, if you look at the global guidelines, people in Canada and Europe, they do the same. They recommend starting at 50.
That's
However,
if you have no family history. If you have family history, certainly much
That
sooner.
is correct.
Okay.
So what is crucial here is, again, coming back to the point of risk stratification, and it is not rocket science anymore. There are actually calculators, online calculators. You punch in the numbers, and it gives you an idea what is going to be your risk of developing breast cancer over the next 5 years. And there are different grades to that. If your risk is less than 15%, you're considered to be an average risk. In those situations, some people do make a case that you could wait until 50 to get screened.
Now, where do we take this test?
It is an online calculator. It is called the GAIL model, G-A-I-L, and it was developed by Dr. Michelle Gale out of the National Cancer Institute. And they developed this several years ago, in fact. They modified that calculator over the last couple of years once we had genetic testing available. And BRCA, as we all know about, there are two different BRCA tests. They incorporated all of that into that one calculator.
Interesting.
And so if you have a higher risk on that calculator, no questions asked. You may be 30 years of age. Does not matter. You get started on your screening.
Such good information. Dr. Gandhi will join us later to talk more about nutrition, and this is something I'm very interested in, and maybe some alternative ways to treat breast cancer. So coming up next on the broadcast, we're going to talk to a husband who is helping his wife fight breast cancer. His story when we come back.